So in diagnostics of acute leukemia, we need to perform several different type of tests upfront at diagnosis. So we do chromosome banding analysis that we have done for many decades. We also do FISH or RQ-PCR analysis. We do genomic arrays. So all these type of tests we need to do in order to identify important genetic markers that are important for risk stratification and for selection of therapy. In more recent years, we have been interested to see if we could replace all these different technologies by performing whole genome sequencing in combination with whole transcriptome sequencing. We have done a retrospective study within Genomic Medicine Sweden in more than 200 cases where we performed whole genome sequencing in acute leukemias, and in order to see that we really can identify the relevant, clinically relevant markers. And what we are planning right now is that we will do a prospective study during 1 year where all patients that are diagnosed with acute leukemia we will perform whole genome sequencing and whole transcriptome sequencing, and in addition to the traditional diagnostic with chromosomes, FISH, etc. And hopefully, after this 1 year period, we will be able to answer the question, can we replace the old technologies and exchange this to only whole genome sequencing and RNA sequencing?